If you're thinking of seeing a plastic surgeon to have something enhanced or something removed, there are some things you have to take under consideration.
Here's plastic and reconstructive surgeon Dr. Jacob Freiman on how you can make an informed decision.
Dr. Freiman, good to see you. Welcome to our show.
Nice to see you.
Let's start with skin cancer. May is Melanoma Awareness Month. And my first question is, if someone is diagnosed with melanoma, as a plastic surgeon, do you think they should come to you or should they go to a surgical oncologist?
I definitely think you should start with a surgical oncologist. They will tell you how much needs to be done. Sometimes you need just an excision. Sometimes you need an excision with something called a sentinel lymph node biopsy. Sometimes you need more than that. And that's really what they're trained for. Plastic surgeon is really trained. We could take it out, but that's not our specialty.
And let's shift a little bit and let's talk about some cosmetic options. Whether it's nose or breast or anything, what are some things that a patient should know before they come to you? Because I'm sure, even though you want to improve your appearance, people are probably pretty nervous about, going under the knife, as it were, and seeing you.
Right. So the first thing you do is you have to find the right person. There are a lot of people claiming to do what we do, and the easiest thing to do is just to find out if they're board certified by the American Board of Plastic Surgery. Once you find that, then you do some research and you look to see what they specialize in. So, for instance, I mostly do cosmetic surgery, but there are other people that mostly do reconstruction. And so you really want to find the right person for the job.
And then you, as a physician, if a patient comes in, what are you looking for with regards to whether or not this person's even a viable candidate for you to operate on?
So you need to be healthy. With things like melanoma, I think you may not be the healthiest patient to start with. But with what I do, they really can't have any medical problems beforehand.
And then once the procedure is done, what can a patient expect? And obviously it depends on the procedure, I understand that. Right. But what can they expect with regards to quality of life? And the next day, are they up and around? What do you tell patients?
Right, so most people, I tell them to start walking immediately right after surgery. And then all healing really goes in the same course. You start off with some swelling and the first week maybe take off of work depending on what kind of work it is. And then you really don't want to go right into doing whatever you did before if it was a big activity. Like I have this week somebody who was a skydiver and somebody else that was in the military and wanted to know if their bulletproof vest would affect the implants and that kind of thing. But in general, you can go back to doing everything you used to do for the first 6 weeks without working out. Working out, you really want to wait for around 6 weeks beforehand.
I'm impressed that so many people want to go skydiving. That's good for them.
It's not a large population, but I do get interesting patients.
Yeah, it sounds like it. How can people reach you?
They can either call 305-446-7277 or the website, drfreiman.com.
Okay, good to see you, and we'll see you again soon.
All right.
You got it. Thank you.
Thank you.